Since my childhood, I have enjoyed playing this game. The game which you would have played with your friends too. Yeah, I'm talking about that legendary game, Doctor Doctor. I remember using that plastic stethoscope and putting it on my friend's chest, acting as if I was able to listen something. The same way my late grandfather used to with his patients. Fast forward 20 years, today I still love to play that game. But it's not a game anymore. People are real, the problems are, and so are the stakes. Today, in the very first episode of Clinical Trick, we will be playing scenarios inspired from real clinical cases. The objective is to solve the case and treat your patient. Bottom line, choose the right option or else there will be consequences. So, the rules are simple. You will be presented a case and being a doctor in the scenario, you will have to make some tough choices. And those choices will decide the fate of your patient. So, are you ready, doctor? You have a patient waiting for you. It is early in the day at 10 a.m. You were visited by one of your old acquaintances from your hometown. A man, aged 55 years old, healthy looking, complained you about this. He said he goes to bed and sleeps in good health. At about 2 o'clock in the morning, he gets awakened by severe pain in his great toe, more rarely in the heel or ankle. This pain to him feels like that of dislocation, then followed by chills, shivers, and a little fever. The pain always increases in intensity from moderate to more intense. He describes his pain as much so that he cannot even bear his weight on his legs and it becomes very hard for him to walk. You then take a look at his toe and find it to be swollen and with diffuse reddish discoloration. Mr. Patel then goes on to deny having any similar swelling in past or being bitten by an insect. Mr. Patel is obese, but other than that, he has no other medical history. He also indulges himself in alcohol drinking, as much as about 25 drinks per week, but denies any tobacco chewing habit. You then examine him and find the following. His body temperature was febrile, blood pressure was at 136 by 72 mm of mercury, pulse was at 90 per minute, respiratory rate was at 18 per minute. Examination of the left first metatarsophalangeal joint revealed a 2 into 3 cm erythematous swelling that is extremely tender on touch and warm, and no other swelling was noted anywhere. Looking at you constantly trying to figure out what the problem is, Mr. Patel got curious and asked, "What is it, doctor?" You are still thinking, but you have something in your mind, and you say, "Patelji, we will need to get a test done to confirm if it is what I think it is." And then you go on to say, what is your probable diagnosis? So doctor, what is your probable diagnosis? You have a plethora of probable diagnoses bombarding in your head. You narrow it down to 3. Bursitis, gout, or paronchia. You have your reasons, but you have to choose one. What is it? You go on to say, "Mr. Patelji, I think so. It's acute gout." Mr. Patel didn't take the news quite well, but he was hopeful that the test you were talking about would come to prove it otherwise. So, doctor, what test should be done to confirm your probable diagnosis? Being a good doctor you ask for the consent of Mr. Patel. You then take out the synovial fluid from the joint space and send it for the test to rule out other possibilities like septic arthritis and pseudogout. Other than that, you also tell Mr. Patel to get the following tests done: full blood count, ESR, C-reactive protein, and the liver profile. It will be a few days till the test results come out. You want to start the treatment. You prescribe the following. So, doctor, what is it that you prescribe? Choose wisely. You prescribe naproxen 750 mg for the first dose and then 250 mg every 8 hours until the attack has passed. You also advise Mr. Patel to cut down on his drinking and eat better, healthy food for the next many days. Your assistant has fixed an appointment on Mr. Patel's name today. He is here now and you are sitting with his report and him in front of you. The report reads as follows. You then talk to Mr. Patel about serum urate level lowering agents. And you tell him that you will be starting the course right now. And you also prescribe him some medication to counter the side effects of the serum urate level lowering agent. So doctor, what are the two medications that you're going to prescribe Mr. Patel? Before bidding you adieu, Mr. Patel, being a hardcore meat lover, asks if he can eat lamb on a regular basis. So, doctor, what do you tell him? In the next coming weeks, you ask Mr. Patel to get another serum urate level test. Mr. Patel now appears to be fine and experiences no pain or swelling. He is strongly and religiously complying to your diet restrictions and is feeling great. In the next few weeks, you decide to discontinue the medication of Mr. Patel. You feel, well, this case of gout, luckily for Mr. Patel, didn't go sideways, and he took to damage control very seriously and very early. You feel you did a good job there, but as you were wishing about his good health, another patient comes in. So that was it for today, and I hope you enjoyed watching this video, learning the points, and you were able to save your patient. So if you are wondering if the other videos will be relatively this easier to navigate, so the answer is no, not every video will be easy. I will try to keep the scenarios on a varying levels. So that is going to be a thing. And if you have not already checked out my other content, I will leave a link below. There is a variety of content starting from documentary style videos to mind palaces, where it will become a very easy thing for you to learn that particular topic. So I hope we will be seeing each other next time. For the time being, this was me, Dr. Saksham. Bye bye. And wait, firstly, you have to like the video and then subscribe, because that is very important. And yes, definitely share the video. And this was me, Dr. Saksham. We'll see you next time. Bye bye.